dry eye disease is a multifactorial condition. And so, and the other thing that's a factor is that signs and symptoms don't always match. And so a patient may present and their eyes may actually look very dry, but patients aren't necessarily aware of it because if they felt it all the time, they would constantly be irritated. So they almost kind of tune down the gain so they're not as sensitive to it. And so there's a sign aspect that we look at as well as a symptom aspect that we look at. And so it can be caused by many different factors and they can all intertwine with each other as well. It's good when you visit your eye doctor to describe kind of the things that you like to do, the things that you're involved in, hobbies, interests, things like that, because then we have an idea of what your daily life is like. And if you are having any compromised activities during those times, for example, a patient who's on the computer and they spend 8 hours a day doing IT production, and by the end of the day they feel tired. Well, it may be because you're working really hard, or it may be because your eyes are starting to get drier. And if there's some things that we can do to provide better relief through that, rather than just going to the drugstore and grabbing the least expensive drop off the shelf, there may be some things that we could do to make you more productive, make you so that at the end of the day when you're done working you don't feel exhausted, but you actually still feel refreshed. And there are things like that that we can do in our dry eye clinic to maybe extend your quality of life, whether it be at work or at play.